Regarding the alternate hospital sites, the two that are decommissioned, what's going to become of their equipment, supplies, furniture, et cetera?
That's still being discussed. You want to add anything, Brett?
We're working through the Rhode Island Emergency Management Agency and FEMA, the Federal Emergency Management Agency, because there's certain requirements around storage of some of that equipment. So we'll be storing and cataloging all the equipment. That which needs to be stored will be stored. That which can be either resold or donated to other community partners will be donated. But the federal guidance around the specifics on that is still being developed nationwide.
Governor, there's 2 weeks left until the October 13th time to get students more back into school. You said the first 2 weeks have gone well. Do you have any indication that many of these school districts are going to ramp up their plans as you want them to do, and that's actually going to happen, or are many of them just going to stick with what they're doing now?
I think it'll be a mix. I think some are still waiting to see how we're doing. But for the most part, I think most are ready to go back to school full in person. So, we're even hearing some potential good news from places like Warwick, who are thinking about getting some of the kids back in school. So I think, definitely Providence and Central Falls, I think, are still going to stick with the hybrid. But I think most of the rest are going to go ahead and do the in-person school.
Do you expect to put more pressure on some of those that do not, seeing as though you kind of set that as more of a hard and fast time to start?
I am continuing to put pressure on them. But also, even more than pressure, we're doing a lot of behind-the-scenes work just to help them do the work to get the kids back in school. So we've sent some folks to Warwick, for example, to just sit down with them and say, how can we help? What's it going to take? What are you most worried about? That's really what it comes down to. The Education Command Center, what we call the Education Operations Center, they've done dozens of missions to the schools. Those are going great. So last week we had a Zoom call with all the superintendents around fans and HEPA filters. So some of it is pressure, because I believe more than ever that it's the right thing to do. I think the damage we're doing to kids by leaving them at home is clear and potentially irreparable, and I worry every day about it. So I am going to keep the pressure on them. But also, I want to enable them. I want to help them. What do you need? Let us help you figure it out. Here's the other thing I'll say. This is really rough on parents as well. I was chatting with someone whose child has an IEP. She's left her job to stay home, to try to homeschool this child. So that is financially really, really hard on her family. But she's not a teacher. I mean, she is struggling to do right by her child. So with each passing day, the facts are our contact tracing and testing is going well. We haven't seen any, widespread transmission. And we're hearing more and more stories from parents and kids who are really struggling and suffering for not being in school. So anyway, as you can tell, I feel very strongly about this, and I'm going to keep it going.
Governor, how did you arrive at the $4 million additional funding for the outdoors program?
We went through the applications. It was an attempt to try to satisfy all the high-quality applications.
And is it strictly for use by businesses that are trying to move their businesses outdoor? There's no additional funding for other businesses of other kinds?
It's for any entity who needs help taking the business outside, which we believe is pretty much any business. I mean, you can have office meetings outside if you have Wi-Fi. You can sell things outside. You can do yoga outside. You can do someone's nails outside. We've seen some pretty the libraries going outside, restaurants outside. So it's pretty wide variety of businesses.
You said you were keeping $1 million or $2 million in reserve?
I think $2 million. Because we think that there's going to be more demand. We're going to do another application round and call for more applications.
Governor, good afternoon. Could you characterize, understanding that there won't be a budget decision until after the election, we're already there, but could you characterize the dialogue you've had or may not have had with Speaker Mattiello and President Ruggiero in recent times, and What's going on in terms of the oversight committee? How involved are they or any members of the General Assembly in any of the decisions that we're hearing about, whether it's schools or business, anything?
So I talk to each of them on at least a weekly basis. I think it's an understatement to say that we're deeply concerned about putting a budget together in November, absent any additional federal stimulus. So what we are doing now is putting together different scenarios. You know, if you have to balance a budget in November with no new federal money, what is that like? With some new federal money, with flexibility with the existing money that we have. Honestly, we're in a bit of a holding pattern until we have some more clarity from the federal government, but we're getting ready. I mean, we're putting together scenarios A, B, and C. They've committed to coming back in mid-November, and the hard work will really happen then.
But is it fair to say, from an oversight perspective, that the General Assembly has any even informal involvement in decisions that are being made right now?
I think it's not that different than how we typically operate. You know, the administration is administering the government, and I have talked to them, if anything, I talk to them more than typical in a time when they're out of session, because I'm having to make decisions, and I want to make sure that they're okay with what we're doing.
Governor, you mentioned that the Veterans Auditorium is going to have a performance, and the restaurants are going to move 8 feet to 6 feet. Are there changes in the schools that maybe they should be planning for? For instance, all theater in schools were canceled, and I know, you know, in a lot of the classrooms, the kids have to be a certain distance. Is this something that maybe they should relook at, like all after school, like everything like that has been canceled for the schools?
I think right now that's appropriate. The performance here, there was no audience. It was a small performance behind stage, and it was streamed out. So, look, we got to get the kids in school. The next big hurdle is the week after Columbus Day, getting everybody in school. Then we'll give ourselves a little time, and then we'll reevaluate. So right now, I'd say no, but in a month or two, maybe.
Speaking of the speaker, he has you in one of his mailers. Did you sign off on that? And if not, what was you did sign off on that?
Yeah.
Okay.
Yeah.
So
He's a Democrat. I support Democrats.
It's also good to see Mr. Smiley once again. We haven't seen him in a while. But just final question: what is your reaction that there will be no Governor's Cup of PC and URI this year?
So sad. That is so sad, but it has to be. You know, it is what it is, and it has to be. But I love that. So next year, or maybe, who knows? Maybe in the spring.
Who takes out the children? Does the first gentleman give out the candy, or does he take out the children?
I always get to take the kids out. Usually.
Question, actually. So I have two questions. First, I know that you received a lot of notifications to your office about the tear gassing or chemical agents being used on protesters. I would like to hear you address that. And secondly, while the President of the United States is basically endorsing the Proud Boys and white nationalists, can you condemn them, especially the ones here in Providence? Can you make a very clear statement going against these white nationalists?
So I appreciate you're here. This is, even though you're not a member of the press, I'm happy to answer the question. And if you want to talk, I'll be happy to talk to you later as well. Absolutely. You know, it's beyond disturbing that the president would in any way condone white nationalists, and I condemn them in the strongest possible terms. There's no place for it, period. And to say it's deeply disturbing that he would do that is an understatement. With respect to the state police's role, they've been supporting Providence from the beginning, and I think I support them. Every use of pepper spray or any use of force is investigated, and these will be investigated, and that investigation will happen to see if they were founded. But by and large, state police and Providence police have worked well together to handle what's been going on in the city.
Governor, during a time though, during a pandemic and a virus that's going around that attacks the respiratory system, wouldn't you agree that police should be using tear gas and chemical agents absolutely last?
I think that their use of force procedures are appropriate, And as I said, they will be investigated, as they all are, and these will be as well.
Lastly, I know you mentioned a lot, and you're putting a lot of the blame for COVID-19 cases on college students. However, on Atwoods Avenue, there are a lot of people that are dying. The police block off the streets, and they don't wear masks, and they sit very closely. What do you say about those people and how they're adding to the spread of COVID as well?
The people on Atwells Avenue?
Yes, as well as the state police officers that do not wear their masks.
So I would say we've had excellent compliance by the troopers for masks. If they're not wearing masks, they need to. I know, in fact, I just called the mayor on Friday and asked if he could work with the folks in the Providence Police to increase their compliance with mask wearing. There's no excuse for anybody not to wear a mask, period. And if they're not, they have to try harder. The fact is, I'm going to put the slides up, we have an issue with people who are 19 to 24. That's not my opinion, that's a fact. The outbreak at PC is a fact. It's a problem. It's the single #1 reason that we wound up on the travel restriction list for these other states. So, like, everybody has to wear their mask. So whether you're on Federal Hill or whether you're on Eaton Street, period. And if they're not, they need to. And nobody's above the law. You know, the cops ought to be wearing their masks just as the governor, just as the president.
Well, Governor, if you started the Crush COVID program to make sure that we're trying to actually stop COVID, having state troopers not wearing their mask, and you're saying that they should be, but it's obviously a fact through the recordings from press.
You know,
that
we
they do
haven't
not wear
found
their
a
mask.
big problem with that, but I can look into it further. They've actually had very good compliance, but if they haven't, they'll have to get better.
I'm sorry,
Tanya Signori from the Rhode Island Echo to the governor. I know this is a medical question, but if you could just answer it as the governor. There's a large number of people at home that are eager to hear your response. There's been a little uptick in the nursing homes, and basically they're wondering why we're still not isolation in nursing homes. Can that be mandated? We have isolation rooms in schools. A bunch of, all the schools have isolation rooms. Why can't hospitals and nursing homes be isolating more, even more than they're already doing? I know there's protocols in place and everything. However, with those protocols, there's still been some spread. So therefore, the disease probably is going further than 6 feet. Research has proven that. Also, if there could be, a mandate, I don't know if you could put an executive order into effect or something where all hospitals and all nursing homes in Rhode Island all have a separate wing for COVID patients and separate staff, because there's been also some mixing of that. Can that be mandated?
Yeah. So I will give you my answer, but I do want the director to speak to it because she's much more in the details of this. For the most part, they are isolating, and they should be isolating. And so, that's the answer. In fact, we even have some, like COVID-specific homes. That is best practice. That is what they should be doing. We also have increased our testing in nursing homes. We've been doing it, and a week or so ago, we got more machines to do even more testing in nursing homes. So I don't know if you want to add to that.
Yes, the first part is to reiterate the approach in hospitals and nursing homes is to make sure that people who have symptoms are isolated appropriately and even more aggressively than what happens in other facilities. We have specific types of rooms that are available, particularly in the hospital, and we have wards and units when there's more than one case in a nursing home where that's allowed. The other element that I will add is oftentimes if we see cases connected to a nursing home in particular, it's less so because of the exposure there and more so because people who are from the community are working at the facility. So the importance of screening is just as critical as what you're asking about.
Thank you.
Tanya, do you have some places you're worried about? If you want to follow up with us separately, we'd be happy to do that.
Thank you.
We'll help you.
Scott, you could actually stay there if you'd like. Springfield, Massachusetts has banned trick-or-treating, and some of the logic they've described is they're concerned about people sort of clustering at homes as they're moving along and a lack of social distancing. Can you address why you think it's still safe to move forward with trick-or-treating here?
The critical piece is wearing a mask. Even in small groups, making sure that mask wearing is done effectively. It's not just the costume That's what allows us to feel comfortable. We know that this is an important holiday. We know there are ways to do it safely. Wearing a mask is key, using the hand sanitizer, and following the additional steps that I shared. Making sure that we're not sharing candy, making sure that you're with your own small, stable group. Doors remain closed, so people are keeping their distance. Goodie bags or candies are individually wrapped. It's a way to put in place the measures that we know are effective while allowing children and families to enjoy Halloween.
Governor Raimondo, I'd like to talk about Twin River for a moment. With the acquisition of Newport Grand, Twin River effectively has a monopoly on gaming here in New England. As a result, a significant market advantage in terms of pursuing the consumer dollar. So they've got a monopoly. They've got the ability to have smoking on premise. They receive millions of dollars in marketing subsidies directly from, in many cases, the businesses that they're competing with for that said economic dollar. They were able to then give them permission to build a hotel despite the initial concerns about that. Now we've enabled a sports book and now a mobile sports book despite constitutional concerns. With regard to COVID, as of a week or so ago, now they're able to go 24 hours a day I understand that their Blackstone bar till 2 o'clock in the morning. At what point does the state of Rhode Island stop weaponizing their private-public partnerships in terms of monopolies against the Rhode Island business community? We all know, every week we have a conversation how the entertainment and the hospitality industry in the state is crippled. And yet the state itself is essentially some of the biggest competition now for that limited consumer dollar. Where's the fairness?
So Twin River, as you know, was essentially closed for months, which is, of course, a big hit to the state's revenue and something we'll have to dig out of the hole of. But they don't have a monopoly in New England, as you mentioned. I mean, in fact, if anything, they're facing a lot of competition from nearby Massachusetts and Foxwoods in Connecticut. So I don't think that it is, as you say, a monopoly or weaponizing that facility.
No Rhode Island
It is unique. We have a state-owned lottery. That's a unique system in Rhode Island. It's been a pretty good partnership for Rhode Island. We haven't had, I will say that they have been really great to work with during COVID. When we asked them to shut down, they shut down immediately. They stayed closed for months. They opened with just a toe in the water. We haven't had any issues with, compliance or spread of cases. And by the way, if we did, we'd have to shut them down again. So, they're operating their business, and it's the third largest revenue in the state. And so it's in all of our interest that they are successful.
Well,
and also their rules that the rules for them are the same as the rules for, the restaurants there have to abide by the same restaurants not at Twin River.
I'm not questioning their corporate responsibility at all, nor the legality within they operate within the rules of COVID. But at the same time, the state has granted them concessions, if you will, to operate that are impossible to get if you're a private business. And one only need to see the sort of destruction in restaurants and entertainment facilities in that area to see that they represent a huge drain on the Rhode Island economy.
Well, as I say, they're the third largest source of revenue for Rhode Island, and we share substantially in their revenue and their profits, unlike any other business. So it's an arrangement that the state made decades ago that, by and large, I think has accrued to Rhode Island's benefit.
Well, in closing, I think, without editorializing, what can we do then to expand or begin to re-expand the hours of ordinary businesses so they have a chance to compete against this monolith here in Rhode Island?
That's something that we will look at. We are going to continue to try to expand. It's a balance. I wish I could reopen every business tomorrow. Truthfully, that would be my desire. But we can't, because then we would have too many, we'd go right back up the curve again. So I assure you that I am looking every week at the numbers, trying to push forward to a further reopening every time we can. Today was a baby step with the 8 feet to 6 feet. and we're going to continue to go down that path.
Doctor, question about the K through 12 testing system. If a person presents with symptoms, are both tests conducted on them, the samples drawn at the same time?
Yes.
And then how do they show up in the dashboard numbers if both tests are negative, both tests are positive, and if the rapid is negative but the PCR is positive?
If both tests are negative, it shows up as negative. If both tests...
Twice?
Once, just one time, per individual. Thank you. If both tests are positive, it shows up as positive one time. If either test is positive, it shows up as positive one time for that individual.
Thank you.
Governor? Did you watch the debate last night?
I did, yeah.
Thoughts?
You know, it was, my primary thought is I really hope Joe Biden gets elected. To me, he was the only one on the stage that was presidential. As we talked about before, I'm embarrassed to have a president who tacitly approves of racism and white supremacy. And as it relates to COVID, it was on full display that President Trump didn't have a plan. And as a result, we're all struggling, and President Biden would have a plan. So that's what I think.
Doctor, I've heard from members of the Equity Council, the Bus Drivers Union, and members of the public this week on the questions surrounding RIPTA buses and capacity and really the lack of a mandate for masking in ultimate bus shelters. What's your response to that? Because obviously on a 40-foot bus, you're going to have people, you're going to have more, I think it's 20 people per bus that exceeds the 15. People are going to, by nature, be closer than 6 feet together. So how does that get squared, and how can you ease the concerns that have been put forth by those entities?
Well, it's helpful to hear this. We can work with them further to address. We want everyone masking, whether it's mandated, whether it's in an EO. We want everyone to understand masking is critical in stopping transmission of COVID-19. That's the number one intervention that will keep us all safe going forward. So we'll continue to work on that. Thank you for bringing it up.